Hello, everybody. This is Dr. Kevin Connors and ready for another Holistic Health Hour. We got a bunch of questions that came in. Reminder for you who don't know or this is the first time you've seen us, go to holistichealthhour.com where you can ask your questions. You can also do it on the live chat. I'll connect the chat right now. So we're ready to go. So if you have questions, feel free to chat them in. Otherwise, go to holistichealthhour.com and you can post your questions on there like a bunch of people did that I'm going to answer, or at least make an attempt to answer right now. First question came in. Do you have any suggestions for a foot bath detox unit that has no or low EMFs? I've used some in the past. They've had higher EMFs and I've had problems. Well, I don't know if you have an EMF meter that you're measuring those EMFs, or you just had issues of ill health when you used it. I don't know. We don't sell a foot bath detox unit to our patients. Most of our patients have a TruRife unit, and the TruRife unit comes with an Ion ProWave, and we have tested that with a EMF meter, and it is very low EMF. There's no EMFs coming out of that. You can get some EMFs coming out of the computer because it's a computer-based program. So when you hit run on the program, whether you're using the TruRife with the bulb or whether you're using the TruRife with the Ion ProWave, the EMFs are mainly coming out of the computer. That's why we always suggest people to close their computer and put it to sleep, and then they don't get any EMFs. As a standalone foot bath unit, the standalone units that are out there, I know Erconia makes a good one. Ion Cleanse was the original, and they probably make the best one that's out there on the market. There's a lot of standalone foot bath detox units that are out of China that I would not recommend. I've tested a few of those, and I don't think they work very well at all. And I've had people give me theirs to try out. I just don't think they work very well at all. So I wouldn't suggest those. I know they're far cheaper. But I do not know the Ion Cleanse, nor do I know if the Erconia brand, what the EMF output on those is. I've never tested that, so I can't testify to that. Next question. Can a 9-year-old with type 1 diabetes use a Rife machine to heal? Well, can a 9-year-old use a Rife machine? So it depends on what type of Rife machine you're talking about. So there's a lot of machines on the market that say that they're a Rife machine because there's no legalities about calling your apparatus a Rife machine. Rife is just the last name of Royal Raymond Rife, who came up and really put frequency healing on the map. So there's a lot of machines out there that are Rife machines. We advocate to use the TruRife brand Rife machine. I also think the GB4000 Rife machine is a good Rife machine. Can a 9-year-old use those machines? The answer is yes. There really are no contraindications. The GB4000 can be it's a radio frequency background. That's what it's using to push it. There can be some contraindications to that. With the TruRife brand, there's no contraindications. It is a true high frequency machine that's using light frequencies. There's no contraindications for age. You could use it. Pregnant women can use it. Little babies can use it. People with implanted devices can use it. There's no negatives to using it. There's no as far as electrical devices, nothing like that. So is it going to be a good fit to use for type 1 diabetes? Um, I don't know. I mean, can you run? So, type 1 diabetes is an autoimmune attack, destruction of the cells in the pancreas that make insulin. So, is the Rife machine going to heal that? I don't think so. So, I mean, if I had a 9-year-old that had type 1 diabetes, would I try using the Rife machine? Sure. Absolutely. Can light frequencies be amazing and heal things that you never would have thought that that would heal? Yes. But we have to use wisdom too. Is it the best tool for the job? Well, there really isn't any tools that are going to heal um, an autoimmune disease. You have to, as far as like a therapy goes, whether it's Rife or whether it's laser or whether it's ultrasound or electrical stim or anything like that, there isn't going to be a tool that's going to heal type 1 diabetes. You have to deal with diet issues. You have to look for triggers. I have a whole course on autoimmune diseases, but definitely with type 1 diabetes, you have to control blood sugar levels. That could be deadly. So if you're not under medical care to control those blood sugar levels as well. So, um, but would it be something that you certainly could try? Certainly, absolutely. Would it be something that I would say that would be my first choice, that I think this is going to heal it? I don't think so. But just try to be honest. It's just Rife and other therapies and other nutritional products and stuff. They're just tools, so they have to be properly applied. Just like, okay, I have a screw to screw in. Should I use a hammer? Well, I mean, you could do the job with a hammer. Is it the right tool to use? No. Um, you have to cut a board in half to use a hammer. No, it's totally not the right tool for the job. Suppose you could break the board in pieces, but you're certainly not doing a very good job of it. It's not the right tool for the job. Same thing with the Rife machine. The Rife machine can heal your cells. Could it be possible that it could heal your cells? Now, somebody might be listening to this and they might call in and say, I used a Rife machine to heal my type 1 my diabetes when I was a child. So I'm not saying that it can't happen, but I wouldn't it wouldn't be necessarily my first choice of that tool. Next question. Soy mimics estrogen. So if I don't have cancer, would eating organic fermented soy help increase my estrogen levels? I'm postmenopausal and my Dutch test confirmed that estrogen is very low. Thank you. Okay, so soy, if your estrogen levels are really low, could you eat soy to bring your estrogen levels up a little bit? Well, I would eat soy isoflavonoids. It's a constituent of soy, but it's not just eating like tofu or a soy product. So it's going to have the benefits of helping balance your estrogens, but it's not going to like spike your estrogens. It's not going to give you the negative xenoestrogens that could cause issues in your body. Fermented soy is the question, though. Fermented soy works differently in your body than soy. Oddly, there's some studies that fermented soy actually can decrease your estrogen load. So, if you're trying to increase your estrogens, I guess fermented soy wouldn't be the choice. Now, understand the benefit of fermented soy really lies with people that have cancer, especially estrogen receptor positive cancer, because fermented soy has been shown to dislodge those bad estrogens from the receptor sites, from the beta estrogen receptor sites on the cancer cells, which when bad estrogens attach to that beta estrogen site, it actually blocks extrinsic apoptosis. And fermented soy has been shown to dislodge that. Now, Regular soy increases your estrogen load, which can then degrade into the 4-hydroxyestrone, which can be that bad estrogen that attaches to that estrogen beta receptor. So there's a very difference. If a person has cancer, and especially if they have estrogen or progesterone or HER2 positive cancer, they don't want to be eating soy. But fermented soy, they do want to eat because it can actually work the opposite of soy. It dislodges that bad estrogen from that receptor site, allowing a greater degree of apoptosis to take place. So it stands to reason, at least, I believe, that fermented soy is not going to increase your estrogen levels. So I don't think, to answer that question, I don't think fermented soy would be the choice. I would use soy isoflavonoids, and you have to get that in a supplement form. When it comes to food allergies, IgG in particularly, being they can change so frequently, how often would you recommend testing? I feel like it shows the state of your gut at that moment, but can change often. Well, I agree. For um, a large part, IgA, food allergies, food sensitivity testing can be a little fickle. So, but it does give us a good picture of what could be causing inflammation at that time. Now, it depends on the food. So the food itself, um, some studies have been done with gliadin IgG antibodies. It shows that they can last forever and cause problems forever, even if a person is on a complete, very strict gluten-free diet. But then other foods can dissipate quite quickly. So when we do like a Cyrex 10, which tests for IgA and IgG antibodies and separates cooked from raw foods, which I think gets more specificity in your testing. I recommend retesting at 3 months. If that's if that's the person's main concern that we're dealing with, trying to calm down the inflammation of the gut. Yeah, that, and again, when you do a food sensitivity test, it's not so much I'm looking for what I can eat and can't eat. It's yes, there's that piece of that. Okay, I have high antibodies to whatever, so I'm going to keep that out of my diet. But it's giving you an indication of the amount of inflammation that's in your gut. If you come back with a food sensitivity test and you have so many things in the yellow and red, I mean, high antibodies to a lot of different things, it really tells you that there's a lot of inflammation that's going on in your. You do want to investigate whether you have paracellular or transcellular forms of leaky gut and differentiate between that. And you do want to differentiate whether you have antibodies to lipopolysaccharides as well, because that's going to tell you other indications of the severity of the gut permeability that's going on. So a Cyrex array 2 can be beneficial to tell you those things. That tells you, the severity that you need to really deal with this issue too. So again, if you're doing a food sensitivity test and all you're doing with that data is changing your diet, you're really missing the whole point. You're doing a food sensitivity test to change the diet, but then to decrease the inflammation and to start healing the gut. So you have to be working on things that are going to heal your gut along with that, or all you're going to do is you're going to do another test in 3 months and you're going to have different things that are going to be out of balance. Oh, now it's not this, but it's this that was in the green before. How come? What's the deal? You haven't done anything to actually fix the problem. With most leaky gut issues, I think I've described this before in other holistic health hours. You could have, when you describe most leaky gut issues, it's typically been described when the gut cells separate from one another and you don't have those tight junctions. That's called paracellular permeability. it can get worse than that. You can actually have transcellular permeability where the cells themselves are so damaged that things are going through the cells. And then in testing, if you have antibodies to lipopolysaccharides, it gives you other clues. Do you know that you have gram-negative bacteria issues as well? Because if you have antibodies to lipopolysaccharides, then you already know that you have damage to the blood-brain barrier as well. So healing those barriers is a key to really getting better. Greetings from Northern California. Oh, hello, Northern California. Are blood cancers such as chronic lymphoma estrogen driven? No. So the blood cancers are not going to be estrogen driven cancer. So the estrogen driven cancers are going to be breast cancer, uterine cancer, ovarian cancer, things like that are going to be estrogen driven. That's the cancers that are be tested for ER, PR, HER2 positive or negative. So you won't have to worry about that. I mean, so should somebody not worry about their estrogen? I wouldn't say that. You still should not ignore the xenoestrogens because they cause other damages too. So does everybody need to do a hormone test? No, but there's benefits to doing a Dutch test, especially for a female, because we're so exposed to so many xenoestrogens. And understand the definition. Xenoestrogens are estrogens that you get from the environment, and estrogen disruptors that affect your hormone balance from the environment. So whether you have cancer or not, or whether you have an estrogen or progesterone or HER2 positive or negative cancer, there can be great benefit to looking at your estrogen, progesterone, androgen levels. And a good way to do that is through what's called a Dutch test. It's a dried urinary test. Easy to get. You can order it on our site, and you do it at home and send it into the lab. And it gives you a lot of data for the money to really see what's going on. And it is interesting because you'll see people that are might be off the board with certain hormones, and it can then when you start to read up on it, it can lead to a lot of other symptoms you're having. And understand, if a person has, let's say I have lymphoma, well, it has nothing to do with estrogen, but it can lead to a lot of other comorbidities and ability for my immune system to function and to be able to fight off other diseases, including cancer. So would you do Dutch test on women on birth control or hormone replacement therapies? If so, aren't those numbers quite skewed? Yes, they can be. So there are some requirements when you do a Dutch test. You have to put in if you're on any of those hormones. But if you're doing hormone replacement therapy, you do want to do hormone testing, because how do you know you're doing the right level of dosage of replacement? So hopefully the doctor who is prescribing hormone replacement therapies is doing hormone testing. Otherwise, they're just guessing. So they should be doing that. If you're on birth control, yes, there are stipulations in the Dutch test. It'll ask you those kind of questions, and depending on where you have to be in the cycle, even if you're not on any birth control, you have to take the test. Depending if you're still menopausal or premenopausal, you have to take the test at certain times in your cycle. Okay, next question. What are your thoughts about taking methylene blue for someone with chronic Lyme and co-infections and brain fog? Yeah, that's not contraindicated for Lyme disease. You can certainly take that. If a person has a chronic Lyme or chronic and autoimmune disease, if you're going to be adding supplements, my recommendation is to add them one at a time. Because sometimes, if you look at my autoimmune course, you'll see that you don't want to be taking things. If you have an autoimmune disease, you don't want to be taking things that are immune stimulators, because you already have antibodies to self tissue. So if you're going to take things that are immune stimulators, Well, you're basically stimulating your immune system to kill that which you have antibodies against, which, if it is self tissue, you're stimulating your immune system to kill your own tissue. Methylene blue is not an immune stimulator. It's typically thought of as an immune modulator. But just because something is typically thought of as something safe, it doesn't mean that you won't react differently to it. Everybody's a little bit different. Everybody has a different physiology, and your body can act differently towards things. So I'd always recommend that you test things. And the only way that you can know that your test is at least the most accurate you can be is to do things one at a time. So you're going to add a supplement. Don't make any other drastic changes in your diet or your lifestyle or your habits or anything while you're testing that supplement. So you can try it for a couple of days. Did it make you feel worse? No. Did it make you feel better? Well, I haven't figured that one out yet, but you're really testing, does that make you feel worse? If by taking something it makes you feel worse, then it's quite possible that it's stimulating your immune system, and that's not a good thing. Now, the issue that I see with people with chronic Lyme, many times they've been told incorrect things like, oh, you're just having a Herx reaction. That's actually good. You're having a lot of die off of the Lyme and co-infections. And that's most of the time when that is happening, that's not what's taking place. That if they do have antibodies in self tissue and they're taking some protocol that's making symptoms worse, more often than not, it's actually stimulating their immune system and they're destroying self tissue. So they're making their autoimmune disease worse. They're actually worsening their condition. Many things are blamed on symptoms and blamed on a Herx reaction, and that's just not true. Okay, question from the chat. Histamines feed my cancer. Most of my protein has been plant-based and are high in histamines. Meat is an option, but I've read a number of times that animal protein can feed cancer. What do you recommend? Well, it's true. Amino acids can feed cancer. The most common amino acid that is a cancer feeder, you could say, is glutamine, L-glutamine, and that's the thing that you need to stay away from, number one. The most common source of fuel for any cancer is going to be glucose, though. By far, it's going to be glucose. So staying on a diet that's relatively low in glucose, what are you eating? Well, you're eating vegetables. Well, a lot of vegetables will break down into glucose ultimately. Will protein break down into glucose? No, protein is going to break down into amino acids. But can my cancer change its fuel source and feed off amino acids? Yes. But by far, in general, you're going to have a cancer that's going to be more glucose dependent. So staying on a low glucose diet is going to mean that you're going to be eating more animal proteins. So again, I'm in the camp that I think it's testing and retesting to see where the fuel source is the best way to go. Second best way to go would be to do experimentation with yourself. Is my cancer staying at bay with my diet? Then maybe stay on that diet. If my cancer stayed at bay with my diet for a period of time and now my cancer is starting to grow, then it's time to change things up and to change your diet. So if I've been eating like a type of ketogenic diet or ketogenic-like, where I'm staying really low on sugar and I'm eating a lot more animal proteins, and then my cancer starts to grow again, maybe the fuel source has changed and you need to switch to maybe a raw, more vegetarian type diet for a period of time. So you have to be able to make changes. Cancer is trying to find a fuel source at all times, so you have to be willing to make changes. Yes, if histamines are a feeder of your diet, you have to be careful of histamines. But the truth is, if you look up a histamine diet online, pretty much everything contains histamine. So you would not be able to eat really anything. So the idea is not to try to eliminate histamines, which is just pretty much an impossibility. It's trying to reduce main histamine load. So even, okay, nuts contain histamine. Should I not eat any nuts? Well, maybe you won't eat a bowl full of nuts, but you can still put some nuts on your salad. So it's a matter of just having balance. You're not getting these histamine spikes. The other thing you do is histamines in your diet obviously are going into your stomach, going into your intestines, and they're broken down by an enzyme called DAO enzyme. Um, if you add that enzyme to your dietary protocol, meaning you take the capsule of DAO when you eat food, when you eat a meal, you will help break down those histamines, and then you won't have that issue with histamines. Histamines can also be an issue, can get more complicated. Histamines can also be an issue if the person has a lot of leaky gut issues and a lot of inflammation from something totally other than histamine. Let's say they have a undiagnosed gliadin sensitivity, so they have antibodies to gluten. They're still eating gluten on their diet. It's causing this inflammation in the gut. So you're causing this inflammatory reaction in the gut, increased production of histamine, and then you're absorbing those, and that's causing systemic inflammation, and that's the problem. So looking for sources of systemic inflammation is the next step to go as well. So I recommend, that's why with all of our cancer patients, we give them access to our autoimmune course. Why? I don't have autoimmune disease. Well, having a comorbidity of an autoimmune disorder with cancer can be a co-feeder of the cancer and a co-inhibitor of a person being able to get rid of the cancer, because they're dealing with these battles at multiple fronts. So if you can defeat the battles at the different fronts, decreasing the inflammation at different areas, your immune system is going to be calmed down enough to be able to concentrate on killing cancer. Then with diet, again, with cancer, you do have to get enough protein in your diet in order to make the T cells and natural killer cells that are so necessary. Those are the subtype of lymphocytes that are really going to be cancer killers. And they are completely dependent on protein intake. So you have to be able to eat enough protein in order to get that. So it's a little tricky to maneuver, but you got to work through those circumstances. What influence do you think copper deficiency has on people? Have people supplemented it even though food or pill form? How much? How would you take? Well, I do. There is a phenomena of in a subgroup of people that have copper deficiency, but by far, it is outweighed by people who have copper toxicity. So copper deficiency exists, but copper toxicity is by far more common. So I'm not a big fan of taking exogenous copper unless you test your zinc copper ratio and see what your levels are. So you don't, one of the worst things with cancer is the people have a copper toxicity, especially in certain types of cancer, like prostate cancer and several other types of cancer. It's very common to have a copper toxicity and a zinc deficiency. I don't let any of my cancer patients take exogenous copper. Copper is going to be a feeder of growth, and all the years of taking care of cancer patients, I've never had a copper deficient patient. So I know it exists. I know it ties to adrenal issues and some other issues, but you need to get a blood test and get it tested. So I am not a fan of using exogenous copper, that is copper in supplements. You'll see in our multi-minerals and things, only choose those that do not have copper. That's one of the reasons why I don't like multiple vitamins for my cancer patients, because they almost always have copper. They almost always have methylated B vitamins, which is another no-no for cancer, and several other no-nos for cancer too. So to answer your question, if you have what would you do with copper deficiency? Well, first of all, you have to get it properly diagnosed. If you have it properly diagnosed and you do truly have a copper deficiency based upon the copper zinc ratio, then you could supplement with copper, but that's not something I've ever had to deal with. While treating breast cancer with nightly Rife programs, I tested positive for some mycotoxins and am also detoxifying parasites, specifically liver flukes and others, I am sure. I've been running separate Rife programs for molds and parasites. Do you have any specific ones that you would recommend, and how often? Well, I wouldn't spend time running any programs for molds. So when you're tested for mycotoxins, understand that is a toxin that a mold produces, and then you have consumed it or breathed it in, and now that is a inert toxin. That's not a living organism. So the programs on the Rife for molds and fungus, um, you really don't need to run unless you think you have an acute mold mold poisoning, living organism. Typically, you're going to have lung issues. So an acute fungal infection typically is going to be lung issues, breathing issues. Then you can run mold and fungus programs on the right. But if you're going off of, well, I don't have that, I'm doing it because I have a positive mycotoxin test, that's not a mold and fungus. That is a toxin that a mold produces that then you consume somehow. So there really isn't a Rife program to get rid of mycotoxins, except doing the foot bath programs with detox and supporting detoxification. As far as the parasite programs, yeah, if you know the specific parasite that you have, then you can run that specific parasite program. I don't know what the specific parasite I have is. We'll run the All Bugs Kill program. That's my favorite. The Rife is the All Bugs Kill. There's an overnight All Bugs Kill if you want to do that. There's daytime All Bugs Kill program. And if you notice that there's stuff coming out of you when you're running a program, then stay running that program. So, frequencies are a little fickle too, that just because we know that this frequency is tied to this parasite, it can function, it can kill other parasites too. So run whatever works for you. Are mitochondria enhancing supplements such as urothinin A safe for use during cancer? The standard answer, a lot of functional medicine doctors out there. Okay, so how can I say this to not be offensive? We have a lot of people that come to us that were put on supplements that I personally wouldn't recommend for somebody with cancer. And here's the reason. So a cancer is rapidly replicating by definition. So something got inside of a cell and damaged the nucleus. Many times it's an oxidative agent. Many times it's some sort of toxin, a poison, can be a biotoxin, but it damaged the nucleus. And now that cell is rapidly replicating cells that are also damaged and in rapid replication. By that definition, they are not replicating super healthy cells. So the mitochondria of these new rapidly replicated cells is not producing the right type of antioxidants and the right quantity of antioxidants to keep that cell healthy. So they're not producing a lot of glutathione, they're not producing a lot of superoxide dismutase and catalase. That makes a cancer cell closer to lethal dose of oxidative stress building up within the cell. And we take advantage of that. So knowing that a cancer cell is less healthy than a healthy cell because it has a greater amount of oxidative stress building up within the cell because the mitochondria are less healthy, we can take advantage of that, and medicine takes advantage of that. That's what chemotherapy does. Chemotherapy is an oxidizing agent, and in doing so, it tips over cancer cells faster than it will tip over a healthy cell that's got a healthy mitochondria and is producing a lot of antioxidants. So when we go and take exogenous antioxidants, meaning supplements of antioxidants, we take supplements that are going to support mitochondrial function. We take glutathione, we take superoxide dismutase and catalase, and other antioxidants. Then we are basically helping cancer cells stay alive. So I don't think that's a good idea. Most natural cancer treatments, okay, standards of care cancer treatments, chemotherapy are oxidizing agents. They're trying to tip over cells that are already in oxidative stress. Most alternative cancer therapies, Protocell and IV vitamin C and Devantine and Hoxy and things like that are also oxidative. So they're tipping over those cells in a maybe less damaging way to healthy cells. And that's the argument for alternative care. But if you are also taking a bunch of antioxidants because, they're good for you, my naturopath put me on these or whatever, that's not the right thing to do. So I'm just totally against that. So I take everybody, come to me, I'm going to take you off all your antioxidants. So unless we're testing you, that tests good for you, but it's few people that do. So I don't think you should be on mitochondrial enhancing supplements. That's my opinion. My grandson, 2.5 years old, keeps getting sick. First strep, then 2 weeks later, another infection and bad cough. Then 2 weeks later, now fever again. He had 2 rounds of antibiotics. What can he do? Okay, so the thing is that when our children get ill, we live in a culture where we tend to run them to the doctor and get an antibiotic. Well, sometimes when you got a nasty strep infection, you should get an antibiotic. You don't want it to lead to something worse like pandas or something. But most of the time, if you let that child cycle through that infection, so when you first get an infection, you have this immediate response, your immediate immune response. That's called a Th1 response with all these different types of immediate immune cytokine releases and chemokine releases that are attacking the infection. So think of it as that this infection, these bad guys that entered the body, and this immediate response is the police force that's going out to try to kill this infection. Well, if it's a pretty nasty infection, the police force can't kill it, and after a few days, the police force gets called back and they send the FBI in. The FBI get in there. That's your B cell or Th2 response to go in there and find the enemies and tag them with fluorescent tape so that now the police can see them and find them easier. That's called a Th1, Th2 full immune response, which is hindered if we run off and get antibiotics. Or the person, my kid's got a fever, so I'm going to take Tylenol. Then we're not letting them cycle through this whole Th1, Th2 response. And only when you go through that Th2 B cell response will you create antibodies against that infection. Now, the benefit of creating antibodies against an infection is that after the infection is over, you still have circulating antibodies against that infection. That's when you say, oh, Johnny's got such a strong immune system, he doesn't get sick. Well, why doesn't Johnny get sick? He's still exposed to everything that Billy's exposed to, but Billy keeps getting sick. Well, Johnny's mom let him cycle through that whole infectious process at least a few times. So now he's got circulating antibodies against that strep. So when he's exposed to the same amount of strep that Billy's exposed to, Billy doesn't have circulating antibodies. He gets sick. Johnny doesn't get really sick. Maybe he doesn't feel great for a day or so, but the antibodies tag the strep, then the Th1 police force get in there and kill the strep. That's what's called having a healthy immune system. So the definition of a healthy immune system means that I have more circulating antibodies against more pathogens than somebody else does. So I have a healthier immune system than somebody else because I have more circulating antibodies against more pathogens. That's what you want to have. That's the only way that you can have that is if you allow yourself to get sick and you nurse yourself through that sickness and have some chicken soup and take some supplements and, build up your immune system and strengthen your immune system so that you do fire a whole B cell response and develop antibodies for that. But I know we live in the last generation, we've lived in a culture where, mom's not home, we can't stay home, we got to run to the doctor, get an antibiotic, otherwise they won't let him back into daycare or school or whatever. And that's not necessarily good. And so we need to develop that immune system. Other things help build up a child's immune system too. Are they breastfed? What's the child's diet like? Are they eating a lot of different foods so they have a good, healthy probiotic sources to help build their microbiota? Are they supporting their immune system through different nutrition? Are they eating dyes and food colorings, or are they eating an inflammatory diet? Or are they eating things that they have antibodies against? Are they eating gluten and dairy and things that they might have antibodies and that are causing inflammation, and they're fighting this battle at both ends, and now they got this inflammatory process fight off this infection? So you want to take a big picture approach to that and dig into this, whether they're 5 years old or whether you're 25 years old. I had hormone-positive breast cancer 7 years ago. My body tolerated tamoxifen for 4 years. Besides DIM, what would be the next best supplement to prevent metastatic disease? Well, your natural aromatase inhibitors are going to be DIM, sulforaphane, and you can go to our website, connersclinic.com, and just search natural aromatase or search aromatase. And that's, I have a whole list of it, an article on natural aromatase inhibitors and things that I would suggest. So I'll let you do that because we're being inundated with questions. But tamoxifen is an aromatase inhibitor. It's blocking all estrogens. You tolerated it well, and it's helped a lot. But when you get to a point, I know they want people to take it for 10 years. Sometimes they'll tell people that you're going to take it the rest of your life, and it can be intolerable. It does block all your estrogens, not just your bad estrogens. So looking for a natural aromatase inhibitor might be a wise choice. Also, running a Dutch test would be, what we talked about earlier in the show, would be a wise choice too, because that's going to give you a picture of where your hormones are at and how much you really need to hit, how hard you need to hit trying to do natural aromatase inhibitors. Is this recorded? I was late. Yes, it's recorded, and you can find all the recordings at our website, holistichealthhour.com. That's where you can ask questions pre-show as well. That's where you'll see all our other shows as well, and they're nicely indexed so that you can find answers to questions. Also, I'd recommend, if you don't get your question answered on the show, to go to our website, like I just explained, connersclinic.com, CONNERS clinic.com, and search, because I have about 1,200 blog posts, and most of them have videos explaining things in detail ad nausea to you to help with the question you might have. Why not methylated B vitamins for cancer? Okay, so methyl groups are essential for life. We need methyl groups. So a methyl group is a carbon with 3 hydrogens, and it can bind to, you can use it to bind to different nutrients to get them exogenously. You also get methyl groups through your foods. So most people that are eating good diets are getting plenty of methyl groups. But taking exogenous methyl groups, methyl groups in B vitamins. So you're taking methylcobalamin, which is methyl B12, or methyl tetrahydrofolate with a methyl folate. Now, most natural doctors will say that's the best type of folate, that's the best type of B12. Well, maybe not. Well, certainly maybe not if you have cancer. The reason is that one of the major things that methyl groups do is they silence genes. So they turn off genes, which you need to have genes turned off at different times. However, one of your greatest way to kill cancer, if you have cancer, is through a pathway called your intrinsic, meaning inside the cell, capsase pathway or intrinsic apoptotic pathway. So the intrinsic apoptotic pathway is stimulated by when a cancer cell is going through rapid replication, it stimulates what are called your tumor suppressor genes. Everybody has them. You have lots of different tumor suppressor gene families. The BRCA gene is probably the most well-known by lay people. So the BRCA genes are a tumor suppressor gene that turns on in breast cancer and can help kill the breast cancer, so you never know you even have breast cancer because it's dead before it gets to a size of you ever discovering that. Now, if you take a bunch of methyl groups, you can turn those genes off. So you can hinder your body's ability to kill cancer. So my rule is if you have cancer, you're not taking methyl groups. Take other forms of B12 and other forms of folate. I have uterine cancer since 2018, but had no surgery, etc. I've been vegan since 2010. It's been getting bigger. So would going raw vegan work, or do you recommend a Rife machine? First of all, yes, I'd recommend a Rife machine with anybody that has cancer. Absolutely, contact our office. But if you've been vegan since 2010 and your cancer is getting bigger, it's time to change your diet. Okay, vegan is not the thing you should be doing. So remember, cancer, if you were listening before, cancer is always trying to find a fuel source. So if what you're doing right now dietarily, the cancer is growing, then you need to change things up. So I'd have to get more data on what you're classifying as vegan. Certainly, like I said, cancer, in order for you to kill cancer cells by your immune system, the subtype of lymphocytes, you are completely dependent upon your protein intake. So I would change up your diet, get a Rife machine, probably multiple other things as well. What do you think about intravenous vitamin C and baking soda intravenously? We found a clinic in Arizona that does that for cancer. Intravenous vitamin C, yes. Baking soda intravenous, I don't know about that. No. Yeah, see, understand. You have a buffering system in your body. You can't, people think, oh, I just need to alkalize myself. I just need to alkalize myself. I just need to get but yeah, no, it doesn't work that way. If your blood varies very much off of, I think, the pH of 7.345 or something like that for blood, you die. So your body will buffer it. So if you could somehow alkalize your blood, your body would have to be working very hard to acidify it to balance out the pH, or you'll just die. So no. Vitamin C IV, yes, that could be a very good benefit for cancer. You could do intravenous vitamin C. You don't have to go away to a clinic. Just every large city has IV centers that you could do vitamin C IV locally. Plus, you need to do that on a very regular basis, once or twice a week, for it to be effective. So, given your views about antioxidants, what do you think about quercetin, which has antioxidant qualities but is also directly cytotoxic, aromatase inhibiting, detoxifying? It's a flavonoid. So yeah, I'm talking about, when you're talking about not taking antioxidant, you're talking about not taking these strong antioxidants: alpha lipoic acid, glutathione, N-acetylcysteine, SOD, catalase. Those are the things that you're not going to be on. So quercetin, yes, you can be on quercetin. That's just fine. It has many other. So there's a lot of different nutrients have antioxidant benefits. Matter of fact, I wrote an article, and it's in our blog posts, called Harnessing Oxidative Stress to Kill Cancer. There's certain things, like you think, okay, vitamin C is an antioxidant. Why are you saying you should do intravenous vitamin C? Well, vitamin C at a higher dosage actually has oxidative stress qualities, not antioxidant. Vitamin E at a higher doses is oxidative. Selenium at high dose is oxidative. Melatonin at high dose, that's why you do 60, 80, 120, 200 milligrams of melatonin for a cancer patient. Well, what does that make them sleep? No, it's an oxidative stress treatment. So that's with a lot of different nutrients. Higher dose, they have more oxidative stress qualities. Enlarged adrenal gland remedies. Um, if you have an enlarged adrenal gland, you want to find out why. So that is not obviously normal. So if was it diagnosed through an ultrasound as being one of them was larger than the other, you'd want to figure out why. Is there a tumor? Is there uh, you'd want to figure out why. Normally, that you don't have an enlarged adrenal gland. A person can be very normal to have an enlarged heart because that person was an athlete or something as a youth, and you can have issues with that. But an enlarged adrenal gland, you'd want to do some more investigation. Listen to a cancer webinar last night advocating hydrogen water. Do you have opinions of hydrogen water better to drink or breathe hydrogenated air? So yeah, there's some data out there about hydrogen water and cancer, and hydrogen water and just general health that is very intriguing. So I think that I don't see anything wrong with using hydrogen water. We did that was about 7-8 years ago. We kind of did a deep dive when that first came out, and the only thing I had against it is that, with our patients, we had them doing a lot of things already. And one of our philosophical things is try not to have the person spending their whole day on different therapies. If you have a hydrogen water machine, I think that's a great thing to use. Echo Water. Yeah, Echo Water was actually the machine that we researched. I think it's a good tool. Is resveratrol and CoQ10 okay since they are antioxidants? Yes. So they have more inflammatory properties than antioxidants. So yes, those are fine to use with cancer. Yes. Okay. The blog kind of blew up there for a second, but I do have a couple questions I got to answer here that people sent in beforehand. Causes of benign tumors similar to the causes of cancerous tumors, toxic, overload, etc. If you have a benign tumor, does that tell us something about our health that needs to change? Well, yeah, whenever you have anything wrong, like a benign tumor or a cancerous tumor or any type of sign or symptom is a sign or symptom that something may need to change. I say may need to change because it could have been something that you were exposed to years ago that you don't have that exposure. You already changed that. For instance, maybe you were living in a moldy house when you were a kid, you picked up a lot of mycotoxin, and that has caused now damage and maybe even caused a tumor. But if you did a mycotoxin test today, your body had cleared it out. That was maybe 20 years ago, and you inadvertently cleared it out because your body is constantly trying to detoxify. But it did lead lasting damage. So it might not be something that you need current change to, but maybe you need current change to help decrease the growth of that tumor. So there's a lot of non-cancerous tumors like lipomas. Lipomas can have congenital, ties to them too, meaning their genetic predisposition to lipomas. A lot of non-cancerous tumors are very idiopathic, meaning they don't know what causes them. Where the hypothesis is that it's same as cancer, it can be toxic load, etc., that can lead to that, but there can be genetic pieces to that too. But yeah, like anything, you do want to investigate current exposure to different things. You do want to investigate toxic levels, and you do want to support detoxification pathways, etc. Especially depending on where the benign tumor is. If you have a benign tumor in your head, that's a space-occupied lesion where you have only so much space, and that can cause just as much problem as a malignant tumor in the brain too. Hello, I live in Albuquerque, New Mexico. In short, many members of my family suffer from chronic and debilitating conditions. Can you recommend functional medicine or holistic practitioners in my area? I can't. I mean, you can consult with me. Everything we do in our clinic is distant. We have patients from in Australia and New Zealand and all over, literally in Europe, all over the world. And so you can make an appointment with us. If you do want to, go to connorsclinic.com and you can um, see that you can schedule now and make a case review with me. If you don't want to do that, at least get on our courses. Our courses are only about $50 right now. And for something like this, I joined the autoimmune course. You can start digging in and diving into some videos and different things and learn that, there's something that you might be exposed to. Whenever you have this multiple family members have an issue, you have to look at familial ties, not so much genetic, but familial ties. Are we all exposed to a moldy house? Are we all exposed to toxic water? Are we all living in an area where there's, a different types of airborne fungi? Are there heavy metals in, our vicinity? Is it EMF issues? There's all sorts of different things that as a group, we're all exposed to that same thing. So, yeah, so you could, somebody did say Sunil Pai has a clinic in Albuquerque, so you can find somebody locally too. So that makes you feel more comfortable. All right. Well, thanks for another episode of Holistic Health Hour. Remember, you can go to holistichealthhour.com where you're going to see these presentations again. They will be indexed. This one will be up in a couple of days. Give it a few days' time. Then you can see all our past episodes. Also, if you have questions that aren't answered here, go to connorsclinic.com, search in the search bar. We have, a nice search engine on there that you can search for different topics. And we have, over 1,000 blog posts with videos. Also check out our video channel and look at our courses. I think you'll find them helpful. All right, everybody have a blessed day, and I'll see you next week. Bye-bye.